It is COPD Awareness Month, which I was just reminded of today, and I didn't know, and was recently diagnosed with it myself. Um, folks can get it for a lot of different reasons. I had some, there's environmental reasons you can get it. Some jobs that you had, the place that you grew up, having bad air quality, um, smoking. Um, for me, yeah, it was a combination of enjoying myself a lot, because cigarettes go really well with things. Coffee, beer, friends. Um, you take a break from work and so on. Um, they're a good friend when you're under stress. Um, but folks can get COPD and having never smoked. People can get lung cancer that have never smoked. Um, so I think mine was probably a combination of a lot of stuff. Um, and to some degree, a lot of folks could get it just to, and on a kind of a smaller scale, asthma and so on. I read quite a bit of stuff written by a pulmonologist who would treat folks with a lot of respiratory issues, but primarily with people who suffer with cystic fibrosis, and especially during, I was reading about it during COVID. So we know that our lungs can recoup. They can repair themselves after you quit smoking or you're out of the environment and so on. Um, so one of the things that the pulmonologist suggested, I know we talked about this before when I had done a video during COVID, and I talked about this a little bit. We know our lungs can recoup a little. Keep in mind that the oxygen level, room air, basic room air, is only 21% oxygen. So you want to make sure that you get oxygen. You want to get outside every day and get fresh air, a lot of it, and keep your windows open. If you have, sometimes you can open the window and get wildfire smoke, by the way. All the wildfires, this is one of the things from climate change is the wildfires, and then folks get COPD from breathing in all that wildfire smoke and had never smoked. But so if you have fresh air, keep your windows open. Sorry about the Netflix sweats and the bad hair today, but so if you have the fresh air, keep your windows open and when it's warm outside, and get a good cross breeze going on. If you're not able to do that in the wintertime, we have the windows closed and the furnace running. So you want to go outside in the winter also, but you can run an air purifier. Air purifiers are really, really important, especially these days again with COVID. Most of them now will kill like 99% of the crud that's in the air, and there's a lot of it. We don't even know a lot of it's there, especially if you have a cat, a dog, or just basically you're alive. So look around your environment and see, how can I reduce the dust? Can I get an air purifier, change my furnace filters, have the ductwork cleaned out? And look around your house and see what we can do to improve the air that we're actually breathing. How do you sleep at night? Do you one of the things that contributed to mine was when I'm sleeping deeply, it kind of sounds a little bit like probably the space shuttle taking off a little bit. I call it the Brontosaurus. But that dinosaur ain't extinct. She's just getting old. And so how do you sleep, right? So do you have sleep apnea? Do you sleep with your mouth open, with your mouth closed? Do you sleep through your nose? Because sleeping well at night is, as we know, is really, 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 really important. So run through your checklist of how well do you sleep, do you need any assistance there, and so on. So check with your doctor and talk to your doctor about, if you have any kind of sleep disruption, any kind of breathing. Everybody breathes differently, and your sleep posture is another one, another thing that can really affect your breathing. Your posture overall will really affect your breathing. As we get older, we tend to hunch forward, which it happens just from having a tired back, and so try to keep those shoulders back. And you want to remember throughout the day to try to do some deep breathing, which not only will lower your blood pressure, reduce those hard thoughts you're having or whatever, but it also does the air exchange in the deep part of your lungs. And you want to make sure that the air in the deep part of your lungs, there's air exchange going on there. The air in the bottom of your lungs can get very stale. And so as you get, especially if you get COPD, what happens is when you get it, the bottom part of your lung tends to flatten. And so you're really only breathing with the top part of your lung. The bottom part of your lungs are actually more to your back, and the bottom of your lungs are actually clear down here. Okay, so if you do that deep diaphragmatic breathing, that will give you good air exchange in the bottom of your lungs, so you can get that stale air out of the bottom of your lungs. And especially first thing in the morning when and of course you're going to cough and stuff, but you want to get that swapped out throughout the day also. So check your sleep. How well do you sleep? But your posture when you sleep is really important. You can sleep better if you prop yourself up at night. You'll get better exchange. If you're a side sleeper like I am, I had to pack like pillows around me and stuff so that I was sleeping elevated, so that I was sleep. I didn't sound like the Bronchosaurus and not roll over on my side. So check your posture throughout the day. How are you sitting also? As we get so where we're kind of collapsing on our rib cage a little bit as we get older, be sure and check your posture and keep those shoulders back, because that will open up your airways too. So it's how we sleep. Check our environment. How can I improve the air quality in my environment? And we can go for a hike in the woods and get some good air exchange going on. Also too, you can train your lungs. When you see kids in karate class and they're yelling, they're doing that because your vocal cords need trained like the rest of you. They're a muscle, and that muscle needs to be strong. And as we age, our muscles and our vocal cords and the muscles in our throat tend to weaken, especially if you live by yourself and don't talk a whole lot unless you talk to yourself a lot. Kind of like I am right now, but the laptop's open, so I guess I'm not talking to myself. But so one way to train your muscles in your throat is to practice your vocal cords. And you want to start out slow if you're not used to doing this, so you don't hurt yourself, obviously. But take a couple deep breaths and just let out a big old yell. Even if you growl, expel some noise. And when you meditate and do your om or your o, that also is building up your throat muscles and your vocal cords. What else? Also, your throat affects your breathing. So if your muscles in your throat are strong, it literally is like clearing. If you use your voice a lot, on the other hand too, you want to make sure that your voice is warmed up. And if you talk a lot in front of groups, you have to talk loud. If you sing, make sure that you're warmed up and that your throat muscles are warmed up. They can weaken as we get older. And so if you want to, you can practice strengthening and open up the back of your throat, which I am not going to show you in video. And But you can practice opening up your throat also. So one thing that you can do to open up your lungs and get the bottom part of your lungs open is to lay on your stomach. And this is why they put COVID patients in the prone position, is because it forces your lungs to kind of open up a little bit on the bottom. So when you're laying flat on your stomach, your lungs are going to open up a little bit. So to open up the bottom of your lungs and get some of the exchange going on and get some of that crud out of there, lay flat on your stomach and kind of pat yourself in the lower part back here where your lungs are. So, again, sorry about the Netflix sweats. Or have someone else do it and tap on the back. And you're probably going to cough, and that's a good thing. Have someone thump on your back to loosen up the crud in the back of your lungs, in the bottom of your lungs. And like I said, if you cough when that happens, that's a good thing. It's also to start out training your lungs. You also, if you can only do it for a short amount of time, and you're coughing, that is you're getting some of that stuff out of you. When you quit smoking, how much fun that stuff is. That's coming up out of your lungs when you first stop smoking and stuff. And again, this is why the deep meditative breathing is so important, because in meditative breathing you're doing deep diaphragmatic breathing, which is opening up your lungs and also reducing your blood pressure and all the other benefits of breath practice. So every day, and the thing with COPD is not getting air in, it's getting air out. So what you want to practice is 3 times take a deep breath, 3 deep breaths, and fill your lungs as much as you can. But when you exhale, you want to exhale really hard. Do that 3 times. And just practice that every day. And I'll show you. Or take a deep breath all the way in, all the way up, fill your lungs all the way up. And we're going to push it out hard. It's like if you're, blowing out smoke. All right. Deep breath in here, all the way in, all the way up. And push it out hard. You should expel all of it, get it all out of your lungs, and do that 3 times in a row. I'm still coughing on the 3rd time that I do it. The other thing too is to remember throughout the day to check and see am I breathing through my mouth or am I breathing through my nose. So there's a couple things that hopefully will help open up your lungs. The other thing that's good practicing, I think we might have done this not too long ago. So it's a technique. I'm just trying to remember if I'm forgetting anything I wanted to say. So this is a technique that is used by folks that deep sea dive and free dive. This guy that I was reading about is also an expert. He's an expert deep diver. So instead of taking one deep diaphragmatic breath, we'll fill our lungs. Excuse me. We'll fill our lungs a little bit at a time. And then you want to exhale all of it all at once. This also is a good training, for your lungs. Okay. And if you do your breath practice through your nose, which is another way that you can if you want to get air to your brain quicker, you actually want to inhale through your nose and exhale out your mouth. That gets air, that gets oxygen to your brain quicker. So, like when you're running, you know, um, runners do that. But if you feel short breath, you want to try to sit down somewhere. Try not to stand up too quickly. Um, but to catch your breath, um, you actually want to try and breathe in through your nose and out through your mouth. So with the deep divers, to train their lungs a little bit, um, is to fill the lungs a little bit at a time. So we're taking short breaths, short inhales here, like about a 1 count, a little bit less than a 1 count. Exhale. Again. All the way up. Practice that. You actually might feel a little fatigue when you first start doing it. I'm trying to think if I've forgotten anything. Probably. Yeah, take a friend, and taking a good walk every day in the fresh air not only increases your oxygen level, but it's really good for your mental state, and that is absolutely the best way to actually to lose weight. And if you're trying to bring yourself back, and so many people have such long lasting effects of COVID. That the breathing with climate change, breathing is really going to become a thing, right? So the more that we practice and work on keeping our environment clean, the better that we'll all breathe. So hopefully there's a couple techniques that you can try. If you have asthma, COPD, and be well. My next video, I think we're going to work on the glutes, the gluteus maximus, the arse, the booty. I think we will do that next. For folks that have like a nagging sciatica, lower back arthritis in the hips, tight ITs. So I think we'll do that and work on the psoas a little bit too, maybe. So namaste and be well.